This week on the BackTable Podcast.
I think for me, the biggest message I want to get across is, for people not to be afraid to post, their own genuine content. I think I initially was afraid at first because I wasn't sure what the reaction would be. But, I think realizing that we each are an individual and we're all unique, and you have something, you have a gift, and it's our job, to extend that gift out to other people. I think, who was it? Mark Twain that said that there's the two best days of your life are like the day you were born and the day you realize what you were born to do. And so when you realize that you're meant to do something and you just pursue it, full on, I think that's really when the creativity and the passion comes in.
Hi, everybody. Welcome to the BackTable Podcast. I'm Ali Behetti. I'm coming to you from Tacoma, Washington. Today, I have the pleasure of talking to, I guess, an old friend, Dr. Gustavo Elias. He's an interventional radiologist at Virginia Interventional and Vascular Associates in Fredericksburg. Dr. Elias, thanks for coming on the show.
Well, Ali, it's a pleasure. I'm a longtime listener, now I guess first-time caller. So thank you so much for having me on.
Oh, cool. Okay, awesome. Yeah, so someday you'll have to come back on again. And I think if you hit 3, you become like a friend of the show, like Luke Wilkins, So we'll see if we can get you on for some repeat episodes.
I need like my punch card with like,
Yeah.
if you get like 5 shows, you get the 6th one free, basically.
Exactly. Our topic today is something pretty fun. It's just social media for interventional radiologists. It's a topic that I've been kind of dealing with my own practice, and I have been able to follow you on Instagram and kind of learn a little bit of tips from you. And so I want to talk mainly about that. But before we get into the meat of the show, I'd like to start with just asking you, tell me a little bit about your practice.
Okay, so our practice, we're a outpatient-based lab, so OBL, and we're based here in Fredericksburg, Virginia, which is an hour south of DC and an hour north of Richmond. We are a vascular and IR practice where we have vascular surgeons and also interventional radiologists. So we see a full breadth of procedures. So we range from the peripheral vascular disease patients, varicose vein patients, and then a good healthy mix of embolizations, fibroid embolizations, prostate embolizations, and then we're starting to get into genicular and hemorrhoid artery embolizations as well, too. And then a nice little thing that we also offer is we work really well with our colleagues in town. So we're the main kyphoplasty providers in the area. And then we also perform quite a few injections, joint injections, epidurals, facets, and things like that.
Okay, yeah. And you're always kind of posted on social media, like little tidbits and stuff about the procedures you're doing. And I think that's super cool. So how many doctors are in the practice?
So currently we have 2 vascular surgeons, and then we have 7 full-time interventional radiologists.
Wow.
And so we're a pretty big group. We're part of a larger radiology practice called Radiologic Associates of Fredericksburg, and we cover 2 hospitals as well as our OBL and several outpatient imaging centers.
Okay. All right. How many days a week do you usually spend in the OBL?
So between 1 to 2 days a week in the OBL, and then the other days I'm at the hospitals. So I kind of go back and forth between the 2 places.
That's nice. It's kind of like a nice hybrid practice. You get a little bit of both sides.
You do. And it keeps the hospital keeps your skills up because, that's where all the complex, DVT cases, PEs, liver cases come up. And so it's kind of nice to have, that balance between the outpatient and the inpatient practice.
Okay, cool. Well, let's talk a little bit about social media. So you are pretty active on social media with images, videos, tidbits. Tell me what kind of sparked your interest in building that to help build your practice.
Well, I'll preface it by saying I am not an influencer by any means. I don't have 1 million followers.
I don't know about that.
But, it all started just because I had a patient of mine who came in for a thyroid biopsy, and she was so nervous about it. And I tried to talk her and coach her through it. And as much as I tried to explain it, she still was very nervous about it. And so I thought, well, it would be so nice if I could actually just share the actual procedures that I do, on the internet or in my social media page. And that's what sparked this whole pursuit in posting more of my content and more of my procedures online. That's how it started. And then I got into, well, let's make it fun and let's make it interesting, because a lot of the information on the internet's pretty dry. and I want to make it somewhat approachable to people. And so that's kind of how I started to mix in music and, fun logos and, funny hashtags and things like that.
Awesome. What has the reaction from your group been to your presence on social media?
They love it. They think some of them think it's hilarious, and then others encourage me to do so because I would say they just think that the content's very good, and they also think that it's much needed. And we've actually been able to get a few patients from the social media presence that not only I have, but also my practice has as well too.
Do you have any dedicated digital marketing in your practice that you pay for?
We do. We do have a little bit of that. We do farm out our social media to a third-party group, and they do a good job at getting, very nice posters, diagrams, graphics. But at the same time, I felt like it wasn't connecting with people. It was just, very vague, very generic. And I think people are looking for something authentic, something genuine, something real coming from an individual. And I wanted to make it so that, I'm an approachable person. And so patients don't come in, they're afraid of me and my needles, basically.
It's so true. One of the things we really we face in interventional radiology is nobody understands what we do, including other doctors, right?
Right.
And I think your videos are really helpful because they explain stuff simply at a patient level, but with the expertise and the backing that you have. So it's not made by some marketer who's Googling what uterine fibroid embolization is and then making an infographic about it.
No, I think you bring up a really good point because we have the expertise, and it's our duty and responsibility to be able to then bring that out to the public. I think it was Hippocrates that said that we're the ones, we have to actually teach the patients about their bodies and about their health. And, there's many ways to do it. One of the ways is with social media. And so if you can make it approachable for people, then they're less intimidated by the actual procedures. And I think you bring up another good point, which is our specialty has a hard time marketing itself because it's a very, complex name when you say it, interventional radiology. It's a mouthful for a lot of people.
That's 20 syllables, man.
I know. And so if you keep repeating it over and over again, no one's going to understand what the specialty is. When you break it down, I say we do minimally invasive procedures and we use image guidance. And so then you bring up several examples. For example, one of the things I like to do is put stents in people's arteries and veins. And most people have heard of stents because they've had a relative who's had a coronary cath. And so that starts the conversation. Or someone has heard of someone getting a biopsy. And so once you start bringing things that are more relevant to people, then it starts clicking with them.
Yeah, I think that's so important. I think one thing Steve taught me is that the average patient has the education level of a 7th grader. And so you need to talk to, I try to say this without being demeaning, but you have to talk to people on that level of education so that they can understand what you're saying. I'm not sure how to say that in a less douchey way, but that thing.
well, no. I mean, go back to our pharmacology class. I couldn't even pronounce half of those drugs. You're just memorizing letters essentially for your tests. And so even us as physicians, we have a hard time, describing our own medications or even our own body parts. And so I think just making it as simple as possible is the best approach.
Cool. Well, let's get back to the social media aspect. Do you guys have a formalized consent process that you do with the patients before you post any of their info on social media, or is it kind of included in your general consent?
So good question. If the patient is going to have their actual face or body involved, there is a waiver for that. For other things for example, an image of an ultrasound or an image of an X-ray, as long as all the patient identifiers are out of the way, I tend to just post those anonymously. Yeah. So it just varies. But we do, if a patient wants to have a testimonial written up, either through our newsletter or through our website, that is a full consent that the patient does sign and waives their rights to. So I think it does vary depending on the scenario and the case.
That makes sense. Yeah. I think because that's a whole thing with posting on Twitter and stuff is oh, do you have consent from this patient to post this? And then half the time, there's no identifying information on it even. So you're kind of like, wow, do I really need consent? I'm not sure. Can this person really be identified based on their images? And oftentimes we're not like posting same day, right? We're posting a couple months after. So that level of identification isn't there.
Yeah, you bring up a very good point. Yeah, like just not posting things like literally that same day and anonymizing things, I think a good practice that we all should do.
Here's like something I struggle with the social media posts, right? I want to get into this, but like I don't want to be cringe. And you are not cringe. And how do you walk that fine line between like being informative but like not like a gross social media influencer type?
Wait, you have to give me an example.
Oh, I mean, like, gosh, like I see doctors doing the like trends, where they'll like, I'm not sure if we should include this in the podcast.
Oh, like the dancing TikTok doctors.
Exactly. Yeah. So like before you post something, do you like run it by somebody and like have them like look at it? Or do you kind of just like, you trust yourself and you just roll with it?
I trust myself and I roll with it. I say, just go for it. So for example, I think I posted earlier in the week, it was January 16th. It was the 51st anniversary of Dr. Charles Daughter performing the first percutaneous transluminal angioplasty. And he did so on an 82-year-old lady. And I found some stock photos online. And then I thought, whoa, what was like the number one hit back in 1964 when it happened? Because I was just imagining what was playing in the background. And so I found like the Supremes had like a number one hit back then. And so that's the song that went with it. Or like a cool hashtag for something. Like, for example, I posted a case where I did bilateral common iliac artery stents. And so we call those kissing stents within our own specialty. So
Sure.
Then I put the song Kiss Kiss by Chris Brown. And then that was my hashtag. So that's just sort of how I roll with it.
I mean, I think probably the most fun part of this is picking the music for these posts. Am I wrong?
No, you're not wrong. And are you a music fan?
Yeah, I'd say so. Yeah.
You'd say so? Yeah, because I love music, and I love all different kinds of music. So my taste is pretty eclectic, and so it's just whenever I'm in the mood, whatever I'm feeling, whatever the post talks to me and tells me to post, that's what I put.
So do you get your ancillary staff involved in these posts at all?
They do. They do deserve a shout out because they have to deal with me telling them, hey, can you take a picture or like, can you take a video of me right now? So they put up with that and I appreciate them so much. So they do help me with that. And I also run certain ideas by them as well. Just in general, even though the concept and the post is all my creation, I do sort of run by a few things with them because otherwise I'm only one person and two hands. And so it's difficult to film and do a procedure and talk and explain things. And so that's why it's always good to have an extra set of hands or two.
Have you gotten any like increased engagement from your younger Gen Z employees? Because I feel like my younger Gen Z employees are like all about it and like want to make these videos. And I'm kind of like, I don't know, guys.
They are. I do get pretty good engagement, even though I'm not a massive influencer. I would say
not yet.
We'll see what happens. But I do get good engagement. So even the people that do follow my content, are always posting me and sending me messages. And that's really how I determine whether or not what I'm posting is good. Is if I'm getting good feedback from other people. And these are also physicians, non-physicians, medical, non-medical people. And that's really how you get a gauge as to what you're posting, clicks and connects with people.
Have you been approached yet by like any physician-related services to become a sponsor?
No, not yet. I wear Figs scrubs, so I that's gonna be my next approach now.
Yeah.
I'm just kidding. No, I haven't been approached yet, but I have had other physicians and content creators reach out to me within the past several months to do other podcasts. So I think the message is resonating with people, and I think we're in a time period where people are looking for, genuine content. People are getting more and more interested with their health. I don't know if you've heard about there's been like a recent ban on, red number 3 dye by the FDA. I think people are starting to learn more and more about their health, things that are poisoning them, things that are affecting their health. And they're looking for people to tell them and to guide them as to what are things they can do to improve their own health. So I sort of have made that like another mission of mine, not just putting stents in people, but also, guiding people and giving them the knowledge to make the best decisions regarding their health.
It's like kind of our responsibility, right? Because we have to control the narrative that's on social media so that the people who are spreading misinformation don't have a louder voice than us.
Correct. Yeah. And but we have the training, we have the background, we have the knowledge. I think just using it, and that's totally fine if you just want to use it for your daily practice. But if you want to also extend your outreach to other people, I think it is our duty and responsibility as physicians to give the patients everything they need to make the best decision. I mean, you can do it in the office, you can do it in the hospital, you can do it online, you can do it through social media. And I think pursuing all avenues is something you want to go for, I think is fantastic.
Okay, so any tips for those of us who maybe want to get started increasing our presence on social media?
I think the best advice I got was just start posting. And
that's scary, right? You're putting yourself out there,
scary,
right?
And you're putting yourself out there. And I think one of my initial fears before I started all this was realizing that if I'm going to have an impact, I have to make myself a public profile. And so I think for some people, just that initial step of making their content public and making themselves public is a scary thought. And then putting your own content out there is also a scary thought as well, because we all have that fear of rejection and we all have that fear of failure. And all of us, I mean, you and I included, we had to grind through college, medical school, residency, fellowships, and each time we're always wanting to succeed. And so I think us physicians have that innate desire to succeed and not fail. And so we don't like to fail. And also our patients don't want us to fail either, because we always have that pressure, you can't mess up. So I think getting over that fear and just starting to post and, be yourself as well too. And once you get over that, just start very simple, very basic. Start with what you're good at. If your niche is embolizations, post about embolizations. If your niche is posting about orthopedic procedures or interventions, just basic injections, go for it. I think it's all about finding what you're passionate about and what you're really good at, and then just pursuing that to the fullest. And then I think from there, other avenues will open up for you.
Do you ever get any negative feedback about the images or cases you're posting?
I do a couple of times. I have posted about, some of my thrombectomy cases, and, some of the blood clots I pull out are pretty graphic.
Yeah.
So there's always a learning curve as to like what's appropriate, what's not appropriate, or what's going to respond well with people. But I also get good feedback. I think at our hospital, we have a whole collage or board of photos that we've taken of all the clots we removed from the lungs.
Wow.
And so I think within our world, it's a very, very cool and appropriate thing. But if you're very queasy, I don't think it's the right content to be posting out there in the public. So it's a fine line. It's a fine line. That's where the feedback comes in, and you kind of gauging your audience and seeing what they like and what they don't like.
Are there any actual resources available for people who want to get started? Pretty much you just roll with the posts.
I just roll with the posts. This is all. This all comes from my crazy mind. It's just me rolling with the punches, and just me pursuing a passion of mine, which is to share my love of medicine and share my love of the procedures that I offer for people. I do suggest that if there are people that you follow on social media, see what they do, reach out to them, and maybe get advice from them and see what they have to offer. Because I think this is all still relatively new, so I don't think there's a textbook or a guidebook as to how to post on social media.
But now there's a podcast episode, so
there is a podcast episode.
So we're all set.
We'll call this the primer of social media content.
I guess we can get into some nitty gritty then. Is there an optimal length of video that you found generates the most engagement?
So I went back to, now there's songs, the perfect pop song, I believe, is under 4 minutes.
Okay.
And so I think content that's more than 4 minutes also loses people's engagement. And so quick hits, so 30-second, 1 minute videos, I think are the best, because people have very short attention spans, and I'm including myself in it too. So the quicker, the more condensed the content is, the more people are going to like it. So that's sort of my general rule. I don't like to post things that are too long.
What about frequency? Do you find like an optimal frequency for how often you post?
So good question. I initially was posting just sort of randomly, but then I was looking at my metrics. So you can look up number of views on your posts and on your social media. Like for example, Instagram, you can look at number of people that looked at your stories. You can look at people that looked at your posts, and you can track that data. And what I found was Tuesdays and Thursdays tend to be the highest traffic days, and then also
Really?
Sundays.
Okay. Sundays. Okay. Yeah.
Sundays. Yeah. Sundays make sense, right? Because, everyone's relaxing. They're at home. Everyone has a few minutes to go check on their phone and on their social media. But interestingly, Tuesdays and Thursdays tend to have the most engagement on Instagram.
How about time of day?
Time of day. So I always say post when people are most likely to look at their phone. So if we start in the morning, you wake up, and let's say your alarm clock is on your phone. So then you show up your alarm clock, and the next thing you look, you check your social media pages and see what people have been posting. So when you wake up in the morning, then we progress during the daytime, and now we hit lunchtime. And so a lot of people take their lunch breaks and will check text messages and also check the social media. Also in the evening, so like dinner time, also another good time to post because people are winding down, people are having dinner. And after dinner, you like to just see what people are up to. And so those tend to be the best times to post and when you get the best engagement.
Okay. All right. Yeah. This is
Does that
very
make sense?
useful. Yes.
Okay.
100%.
All right, good.
How about like cross posting? Like you mentioned, you've collaborated with other podcasts. Do you ever like collaborate with other physicians or other specialties for your posts?
I do. And I actually, that's a very underutilized tool that you can use. I actually should do that more. But that's a very good tool that you can have is tagging other social media influencers to get your outreach out further. I've done this with several of my friends, and I post them on different platforms and I'll tag them onto it. And so they'll share it and then it reaches out to more people. And that's how you can extend your outreach. I think that's a great tool. I just haven't used it as much as I should. I think you guys do a great job of it, though. I know seeing on LinkedIn, especially, I think you guys tag like 30 people for each
that's
post,
all
which
Aaron.
is very good.
So Aaron like legit wrote my LinkedIn profile because I was like too lazy to like log in and make a LinkedIn profile. So he's cool like that. He's a cool boss, I guess.
That's awesome. Oh my gosh.
Yeah. Sorry, Aaron. Sorry, I don't know if I'm allowed to say that, but you did. You totally did.
No, he deserves all the kudos.
Like the different platforms have different expected audiences. I see like a ton of posts on LinkedIn, but I always feel like those are aimed at other physicians. Would you agree?
I agree with you.
Yeah.
I think LinkedIn is like the professional page, and so a lot of that content is going to go to other physicians. I actually like LinkedIn because it's a good way to look at how other physicians or other interventionalists are performing their procedures, and you pick up a cool trick or two here and there from different doctors. And then also a lot of the device companies that we work with. There's so many of them that I use, but they look at your content as well, and I think that's a good way to collaborate with them too. But yeah,
Sure.
I would say LinkedIn is the professional side of interventional.
Okay, and then we're recording this like right before the TikTok ban, but I think by the time this episode releases, I think it's very likely TikTok will be banned in the U.S. Right?
I know it's I did hear that news, so it's sort of, I don't know what's going to happen after that. I actually haven't used TikTok.
Oh, really? You just pretty much, that's because you're a millennial, man. Like we stick to Instagram, right? And we watch the reels when they're 2 weeks old, like normal millennials do, right?
Oh my gosh, you read me like a book. That's funny.
And then how about like Twitter? Do you find any benefit in engaging with Twitter?
Twitter is very good. The one limiting thing with Twitter is the number of characters, and then also Twitter for our specialty, it's very image based, and so that's why I think Instagram works so well with it, because Instagram is all about pictures. Twitter is very good for getting your message out to people. Like if you have a certain platform you want to use it for, I think it's fantastic. But for interventional, it's a bit more challenging to use. But I think it's becoming more and more media friendly than it used to be.
Yeah, because Elon posts like 30 times a day, basically.
Yeah, he does, yeah. You always know what he's up to.
Yeah. God bless him. I mean, Elon, if you're hearing this, I mean, you're awesome.
No, Elon's great. I love Elon.
Are there any parting words that you have for our audience?
I think for me, the biggest message I want to get across is, for people not to be afraid to post, their own genuine content. I think I initially was afraid at first because I wasn't sure what the reaction would be. But, I think realizing that we each are an individual and we're all unique, and you have a gift, and it's our job, to extend that gift out to other people. I think, who was it? Mark Twain that said that there's the two best days of your life are like the day you were born and the day you realize what you were born to do. And so when you realize that you're meant to do something and you just pursue it, full on, I think that's really when the creativity and the passion comes in.
Dr. Elias, thank you so much for being on the show. It was really nice to see you after many, many years. It's always great to see a friendly face when I get to interview somebody I know on BackTable. And I'm super excited about your practice and excited to see you grow. Looking forward to some TikTok dances in your future or major promotional
I have
deals.
like 2 dance moves. So, I mean, I can only make like 2 videos and then that's it. It's over.
Thank you so much for listening. If you haven't already, make sure to subscribe and follow, rate the show 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable on Instagram, LinkedIn, X, TikTok, or Blue Sky. BackTable is produced and hosted by myself, Aaron Fritz, and co-hosts
Chris Beck,
Sabine Don, Michael Barraza,
and Ali Behetti.
Our production team is led by Kieran Gannon,
Aaron Bowles,
Gabe D'Agrazio,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang,
Manisha Naganathanahali,
and Manbir Singh Sandhu.
Administrative support provided by Judy Dela Cruz.
Thanks again. See you next time.